Okay. Officially recording. We'll be posting other sections as well. So there's plenty of opportunities to attend additional HESI reviews with other instructors. And I've sent you the master schedule, right? Everybody has that? Okay. So how, before we officially get started, how's everybody feeling about the term, about the exams, about HESI? How are you guys feeling about it?
Nervous for HESI.
Sure. You have your study guide, and then I have a document I want to share with you that has specific topics of questions that are going to be asked. You know, as far as HESI goes, HESI is like the NCLEX. We don't develop the HESI exam as instructors. We do the exams, right? Exams 1, 2, and 3, but HESI is developed from a test bank. Okay, well, we do not know the questions. We do know the topics that are being covered, the concepts that are being covered. That's what I want to go over with you today. Okay. Everybody get scheduled for their HESI. Anybody having trouble getting scheduled for their HESI? Okay. Vulnerable populations assignments were fantastic. Fantastic. Well done, you guys. Really, really, really good. Enjoyed reading them. So well done. Well done. I think, is it this week? When do you guys have when is our last NCLEX due? Let's see.
I think it's on the 19th.
So it's this coming. So you do have your last NCLEX due Sunday, right? And then that's it. And for those of you still working on your no, your case studies are done. So yeah, after your NCLEX Sunday, you're good.
Will we still need to come to class next week since it is HESI
No.
week? Okay,
Great.
just want to clarify that.
Great question. You'll be taking your HESI next week. Okay, so no, there won't be any class. However, if for some reason you've done poorly in the class and I'll be sending out an email to meet with you early in week 12. I really suggest that as soon as you take the HESI, please get going on your remediation. Don't wait till Monday to do your remediation.
Do we attend week 12?
What?
Do we have to attend week 12?
No. Nope.
So this is our last attending class?
Yep, because next week you'll be taking your HESI and then you have to work on your completion of remediation.
I know in the past they made us come in for like 15 minutes.
Nope. Your attendance confirmation next week is going to be you taking your HESI, and your attendance confirmation for week 12 is completing the remediation. Does that make sense? So work on your remediation. All right, just get that done. Don't wait till the deadline on Monday. The remediation's good. It goes through what you got wrong and why it is wrong and why the correct answer is right. So it's really good. Remediation is always a good opportunity to learn. Okay. Who am I missing? Caitlin, Miranda, Adriana, you're here, right? Is Adriana here?
I think there's two.
What?
I think there's.
Oh, I know. Oh, I'm sorry. Yeah, the other Adriana. Yes, I don't see her. And Jasmine is not here. The other Adriana.
I just texted the other Adriana to see where she was at.
Caitlin, Miranda. Okay, so we're still missing 4 students. Okay, so I've already sent you the remediation guidelines for the amount of time you have to remediate based on your score, right? Everybody got that? Okay. If you could let me know after you take your HESI, I'm in and out of Evolve all week next week, looking at HESI scores. But if you'd like to let me know that you took it and what your score was, that's great. I'm sure all you guys are going to do really well, right? We say to aim for 1,200, 1,300, but just do your best. Don't go into your HESI thinking, oh, I only need this score, or I only need a 800, or just go in and do the best you can. Okay? Don't shortchange yourself. Go in and do the best you can. All right, let's go through two documents I want to go through. One is, let's go through the HESI study guide, or at least through the formatting of it. And then we're going to go through this document here. Oh, no, wait, I have to share. Sorry. 1 second. So does anybody have any questions before we get going here? Questions about the next couple of weeks? Okay, so let's go through the HESI study guide. Everybody see that? Okay, this is a huge document. I get it. If you're just getting after looking at it in the last couple of days, it's probably going to seem overwhelming. If you've been looking at it for the last couple of weeks, you'll realize that the sections in here are sections and topics and concepts we've covered in class. Okay, so does everybody have their HESI study guide? Okay, so I'm just going to go through the structure of it because I want to cover this Excel spreadsheet here with you, which are topics that are covered on the HESI. And that's from reviewing past HESIs to see what they're asking about, what topics they're asking about. So I want to spend some time on this document, but I also want to go through the structure of this. Okay? So we know that this is not an all-inclusive study guide, but I can tell you it's an excellent summary of what's going to be covered on the HESI. Okay, so some helpful hints for success. Take your 3 study guides from your 3 exams and study those as well. Use your study guides and use this HESI review. Okay, we've been talking about ADPI nursing process all term. Okay, so this is our next gen format where you're taking your knowledge that you're learning and applying clinical judgment, excuse me. All right, so this isn't just to memorize, we also have to apply. Okay, thinking about priority questions, right? Priority type questions, priority type concept, safety, management, ABCs. Right? Reviewing primary, secondary, tertiary. There's an excellent chart in here about primary, secondary, tertiary with regards to any of the illnesses. Okay, this is a very med-surg focused HESI. Because remember what I told you at the beginning, we're pulling everything together now. All right, we're pulling peds, maternity, med-surg, fundamentals, pharmacology. We're pulling everything together. Okay, so this is heavily med-surg focused. Okay, so next gen type questions include a lot of prevention type questions, primary, secondary, and tertiary. Okay, always assess for abuse and neglect in every age group. Remember, we're mandated reporters. Review and remember how to conduct a community assessment and how to validate if your community program is viable and sustainable. That's in your study guide here. What do we remember about the epidemiological chapter, the epidemiological triangle? It's in your study guide here. Remember your NCLEX questions that you've done, your case studies have all prepared you for this. The discussion posts that you did. Okay, we don't do Kaplan, so that needs to be taken out, but your next gen case study that you're working on. Oh, that was already due. So that should have helped you, right? So you've got to remember the principles of be able to apply down here, clinical judgment using the nursing process, med-surg principles, safety and delegation. Okay. So this study guide is broken out into different sections. The first section is population groups across the lifespan. This is a long section. I think it's like 18 pages. But what it does is it separates each age group. Okay? It talks about infants. In this section, what you have are the risks. What are the risks at a specific age group? Okay? It talks about education. So, for example, infants, children, toddlers, school-age children. Okay, it goes through screening and preventative measures for each group. So have an idea about that. And then it goes through education. Okay, so the first group we're talking about is children. Okay, that's the first section. And then we jump into adolescents. You have the same information. What are they most at risk for? What do we like to screen for? And then education. Okay. Then it skips to the next group, which is women. Okay. Same information. What are the risks? What are the leading causes of death? Education. And then the next group is men. Okay. And then the elderly. And then older adults, or excuse me, this is in the elderly. So you've got school children, adolescents, men, women, older adults. This is still in older adults, and this abuse and neglect with older adults. What page are we on? And the community education. Okay, so that whole section is broken out into 6 different populations. Each of those populations, we talk about risks, prevention, screening, education. Make sense? That's what that whole section is about. So please have an idea of what the 6 populations we're talking about. What are their, the elderly section is quite long, but what are their risks? How do we help them? How do we educate them? What kind of prevention screening are we doing with each of these groups? Okay. This is so this is the end of that first section. Okay. It's 12 pages. Okay. So that whole first section, the whole first 12 pages is on risks across the lifespan. That's why we're identifying all these groups. Okay. So let's take a look at this level of prevention. Okay, I want to make sure you go into this understanding crystal clear the levels of prevention. Okay, primary is prevention. Well, let me start off by saying, and I probably said this early in the term, don't get distracted by education only being in the primary prevention. Education is at all 3 levels, right? We could be educating to prevent in primary. We've identified people at risk in secondary, So we're going to educate them there as well to prevent it from going, whatever condition, disease, prevent it, try and stop it in its tracks before it gets to tertiary. And in tertiary, we're still educating because they have something going on, and we're educating them on how to manage their disease or manage their chronic condition. Does that make sense? So primary, we're trying to prevent something before it happens. Lots of education in this area. All right, so maybe I'll use my school nursing, where we're teaching to prevent, or we're teaching about the risks of obesity. We're teaching about the risks of substance abuse. We're teaching about the risks of bullying, about violence, suicide prevention. Okay, you're trying to prevent something before it happens. Yes, primary does include lots and lots and lots of education, but so do the other intervention levels. Okay, secondary, early identification. Early identification, early intervention. We are trying to identify at-risk populations, right? That's why we do mammography. We're trying to identify any risks. That's why we do pap smears. That's why we do blood pressure checks. That's why we do primary care visits, right? We're trying to identify any kinds of risks early on. So we're screening. Okay? Trying to early identify any kind of risk going on so that we can try and reverse that risk before it turns into something. Make sense? Tertiary. The easy way to remember tertiary is if you have a question that says, the client has diabetes, what's the best, and we're teaching them about blood sugar screening, what level is that an example of? If the question says they have any kind of a condition or a diagnosis, it automatically starts with tertiary. Because let's say they have diabetes and you're screening them for something. It's still tertiary because the underlying issue is they already have a disease. Right? Does that make sense? And I reviewed this with a student earlier. So anything, so we have a client with substance abuse. Any kind of intervention we're doing with the client with substance abuse is always tertiary because they have the underlying disease. But let's say you had a client you were working with that had substance abuse, and you're meeting with them, primary care, and you say, hey, don't forget, it's still important to have an annual mammogram, still important to have an annual pap smear. That has nothing to do with their diabetes, right? So those become secondary interventions. Does that make sense? I don't want to confuse you, but anything you're doing to try and help them manage their disease is always tertiary. If you're doing something other than what their disease requires, then it becomes primary or secondary. I think I explained it to the student better than I explained it to you. Do you guys understand that? If you don't, let me know now. Okay. So again, if a question identifies they have something going on, tertiary right off the bat.
Okay. But you also said that if they already have it also as a secondary, right?
Nope. What I said was, let's assume you have a diabetic patient. Okay. All the interventions you're doing to help them manage their diabetes are blood sugar checks, making sure they have enough insulin, making sure they have somebody to care for them if they can't care for themselves, making sure they're having regular foot checks. All those things you're doing have to do with their diabetes, right?
Right.
So that's tertiary because you're helping them manage it. On the other hand, take the client with diabetes. Let's say it's a middle-aged female. You encourage them to get a regular mammogram, aside from their diabetes. Okay? That has nothing to do with their management of the diabetes. Right? So it becomes a separate, you have to think about that separately. It has nothing to do with their diabetes. You're encouraging them because of their age and their history or whatever to get a mammogram. That becomes a secondary, right? Because it has nothing to do with their diabetes. Does that make sense?
Yes.
Okay. All right. Carrie, how'd I do explaining that?
Perfect. Exactly.
Okay. I was going to have you explain it to the class, actually. Okay, the next section is specialty nursing. What kinds of specialty nurses do we talk about during the class? We talked about the school nurse. We talked about the faith community nurse. We talked about the hospice nurse and the home health nurse. Okay. So all that is right in this section, specialty nursing. I'm just trying to help you navigate through this. Okay. The third section is the role of the nurse. We talked about this all term in every class. What's the role of the nurse? Okay. Part of our role is family assessment. Remember the eco map and the genogram? Remember the eco map? Here it is right here. It's part of our role. Remember, all of this now is under the role of the nurse. So in the role of the nurse as a community nurse, we do family assessments. Remember, the genogram is the generation, the what am I trying to say? Past medical histories. Okay. We usually typically go over 3 generations, find out who has what, who has died of what, as far as relatives. It's your genogram for the last 3 generations, which may help guide your risk factors for certain things. And your eco map is the family's social interaction with the community. All right. So interaction with other groups. Okay. So are families involved in a church or a mosque or a temple? Are families involved with youth sports? Are they involved with, do they have friends and relatives close by? What is their social network in the community? Are they out there or are they very introverted? Okay. The other role of the nurse we have is prevention of violence. Okay. 4th is our role when working with vulnerable populations. Here's a list of what we could be doing. Sorry, I'm still trying to get over this pneumonia. I apologize. Okay, so that's our 4th, working with vulnerable populations. And this information in here should be familiar to you. Okay, what is the nurse's role and what is our legal and ethical responsibilities? Part of our role is being able to identify what professional negligence and the our scopes of practice are. Part of our nursing profession as a role is understanding what ethical principles are. So this whole section is under nursing role as a community nurse. Here's our ethical principles. And then the last part of this section is some professional tips for us in our role, tips for action. You're not going to get any questions on that, but those are things that we could be doing. Okay, the next section, big section, is program management. A lot of what we do in the community is education, teaching, developing programs, developing in-services, developing training programs. Okay, so what does program management look like? Here it is. Okay, so this section is all about program management. And it takes you right through the nursing process, right through the ADPI. Okay. The next section is infectious diseases. Remember our epidemiological triangle, the agent, the host, and the environment. Somebody please tell me what each of those are and give me an example.
The host would be like us, humans.
Okay. And what do we have to be infected with? Some kind of agent, right? In the environment is what's going on that's going to affect the relationship between the agent and the host. So here's a good visual. So let's start with the agent down here. The agent could be a chemical agent, drugs, toxins, could be a physical agent, maybe noise working in a noisy plant, temperature working out in the farms. Infectious agents could be viruses, bacteria, COVID, the flu. And then the host is who's going to be infected. Okay, we're going to be infected. But what affects that? What affects how sick we get or not get from whatever agent we're talking about? Our age makes a difference, our gender makes a difference, or could genetics, ethnicity, maybe your immunological status, your physiological state, your occupation. Right? So can you see how that may play a role in how we react or how sick we get if we're infected with an agent? And then the last is the environment. How does the environment play into this equation? Okay, you've got an agent, you've got a host. Do we have a healthy host or do we have a immunocompromised host? Do we have an Asian and we have a very elderly person? Do we have a very high risk occupation? Okay, so some of the things that can affect the relationship between your agent and host is your environment. Where do you live? How's the water and food supply? Presence of reservoirs, vectors. What's the social environment? Is there access to healthcare or limited access to healthcare? Are there high-risk working conditions? Is it a community that has a high poverty rate? So the environment plays a role in the host and the agent. Does that make sense? So if you look at these three makeups of the epidemiological triangle, there can be a gazillion formulas, right? Because they're all intertwined. And depending on if the agent is minor or major, if the host is healthy or ill, if the environment is strained, or it's a fairly decent environment, that all those three make up. Does that make sense? Okay. And then here it just gives more detail about the agent, host, and environment. Okay. Okay, so as you can, well, let me back up a little bit. As you can see in the epidemiological section, let's see. It goes through exposures. So have a look at that section. Okay, goes through different kinds of exposures. There's some kind of an anthrax question. We'll get to that in the next the spreadsheet I want to go through with you. The next is disasters. Okay, so read through that section. This is what is our nurses' role in disasters? What are the levels of preparedness? So again, things we've gone through in class. We're just putting it all together for you in a big summary. Goes through each of the stages of disaster. Next section is culture. Talked about culture a lot through this whole class. Pretty detailed section. It's actually a really good review section. Okay, and this is what we talk about, this 3 stages of cultural competence. Cultural competence is critical to our nursing profession. It's a lifelong learning process. After 40 years in nursing, I'm still learning to be culturally competent. So culture is really important in our profession, but it's also covered pretty good on the HESI culture. Okay. And then rural versus urban, we talked about this. Okay, so that's your next section. And I think there's one more section, federal agencies. These are the federal agencies to be aware of, the major federal agencies to be aware of with regards to public health and community nursing. Oh, community assessment is the last section. Community assessment is covered heavily. So please review this last section. It should be kind of close to the front, but it's at the end. So make sure you are reviewing this information about community assessment. Okay. Okay. So those are the, I believe, 7 sections of your study guide. All are concepts or topics that we've covered during the term. Keep it organized. Maybe just read one section at a time, right? Don't let it all flow into each other. Each section is specifically designated to be its own concept to cover. Does that make sense? So if you sit there and read 60 pages, you're going to go, oh my God, I can't figure this out. Just hone in on a section and then take a break. Remember all that we covered in that section. And then go back and read another section. That's why I've highlighted the major 7 topics or concepts to break it out for you, so you don't just feel like this is a continuous book to read of 60 pages. Make sense? Okay, let's go through this spreadsheet. So this spreadsheet we put together a couple of terms ago. Okay, go down here. Excuse me. So after reviewing HESIs, actual HESIs over the last 12 months, so 3 or 4 or 5 HESIs, and we constantly update this, we can see through your testing and your remediation, we can see what topics are covered. Okay? We can see what topics are covered in your HESI. We have no idea what the questions are, but we know they're asking a question. So for example, we'll start back here. These were, we call this 2023 losers. So in our January term, these were the most questions that students got wrong. Okay, so this was a summary, but we have a page on community, vulnerable populations, disaster, child development, geriatrics, and infectious disease. Okay, so these are the topics that are being asked about. I'm just trying to get you guys to a better, there you are. Okay, so topics for review and consideration. So here are the topics to review. The ones in red are the ones that were an issue. So ignore all this. This is all just categorizing the question. What does polypharmacy mean for geriatrics? What's polypharmacy?
They have medications in more than one pharmacy.
Okay. Anybody else want to add to that?
They're taking a bunch of meds and they might not be organizing them correctly, so they're mixing them up times and when they're
okay. So
specifically, isn't it more than 5 prescriptions or
multiple prescriptions? Let me step back a little bit though. Lines 2 through 13, 12 were questions about this topic. Students seem to do okay on these. Community program design, assessment, community risk findings, epidemiological, there's your agent host environment question. Flu vaccine priority, program goal setting. This was all specifically asked about. Why are they asking a question about the endocrine system? What do you think they're asking about? What are they asking about?
diabetes, probably.
Diabetes. Outcome evaluation. They're asking a question regarding GI and hepatic. And the question is something about hepatitis A risk. That's in your study guide. There's a section on hepatitis. They're also asking a reproductive immune hematology question. Secondary prevention, HIV. Go back into your study guide. What would be a secondary prevention for HIV?
Wouldn't it be screening?
They're asking a question, respiratory.
It'd be screening for.
Go ahead.
Screening for a condition that isn't related to HIV.
Exactly. Yep. They're asking a question about TB skin test follow-up. What do they want to know? What kind of question might they ask? It's pretty specific. TB skin test follow-up.
When you come back from 48 to 72 hours to see the diameter between of the test around it. So
that's a very valid question. Here are some of the ones that students struggle with. Okay. Polypharmacy. Looks like this one is diabetes, diabetic complications in home care. That's in your study guide. All right. So I'd be studying what are some potential diabetic complications in the community setting or the home setting, and what's the home care associated with that? The other question students struggled with was diabetic foot care in the geriatric patient. There was a question about diabetic foot care. Does that make sense? There's also a question that students struggle with regards to COPD and ADLs at home. What do you think they might be asking about? If they have COPD and they're talking about ADLs, maybe their oxygen before they eat, during eating, do they keep it on after eating? What's the best way to manage accomplishing your ADLs at home with a COPD patient? Maybe they need frequent breaks. Maybe they can only accomplish a little bit at a time, right? Here are some other topics that were asked about. Diet and stress. So this was under pediatrics, basic nursing skills, nutrition and teaching. Diet and stress. Something about, what do you think? Diet and stress. What do they want? What are they going to ask you about?
What are they eating to cope with it?
Yes, possibly. What else? How stress affects
Their
your diet,
cortisol?
how your weight affects stress. Maybe it's obesity or
maybe depending on the economical status and what they can buy for food to eat.
Exactly. Next question was about, I don't think these are in exact order, but daycare endemic. What are we at? What do you think they're wanting to know about there? Maybe communicable infectious diseases that pass around daycares? Maybe universal precautions or control, good hygiene? Can anybody think of anything else? Heart healthy diet. What's a heart healthy diet? Should probably want to review that. Long-term care, infection. Okay, so again, this one comes under the category here is hygiene. Hygiene, safety, teaching, leadership, long-term care, infection. So I would gather that maybe there's a question about maybe how to prevent infections with long-term care facilities, right? Another safety, teaching, leadership, quality, health, bicycle safety. What are we going to ask? What are they going to ask about bicycle safety?
Helmets. Do they wear helmets?
What if it's a primary, secondary, tertiary question? What is bicycle safety going to fall under?
Primary.
Why?
Because you want to prevent
Exactly.
like a bicycle injury. So preventing it would be all like the safety stuff of like the helmet, the padding, how to ride it properly, like with training wheels, taking training wheels off. So it'd be more of a primary than anything.
Okay. Excellent. Here's another hygiene. This is med surge. Basic nursing skills, hygiene, elimination, teaching. So diarrhea and mass flooding. That tells me it's going to be some kind of a disaster question, maybe, right? That if you have a disaster and there's mass flooding, is diarrhea a huge risk? Cholera, diarrhea, right? Line 28. And actually, we're not going to need to go back through all these ones because what I'm finding here is this is a good summary of everything on all those 5 sheets. So this is the summary. So this is good. Respite care. What's respite care? How is that different from hospice care? What's respite care? Got to know this.
Isn't it like a rehab?
When you give the family a break.
Yeah. Giving the family a break, respite care, planning for breaks, planning for coverage. Okay. Here's some couple of maternity peds questions. Postpartum, breastfeeding. What do we think? What about breastfeeding? Do they want to know?
Probably teaching them how to like wean off of breastfeeding since they're getting older now.
Mm-hmm. Or maybe how to breastfeed in the beginning. Another maternity question, antepartum teaching, teen pregnancy. I'm thinking this is maybe preventative education on the risks of teen pregnancy, maybe? Risks associated with it? Or if a teen maybe is pregnant, making sure that you are working with them. What were the important things? Keeping them in school, making sure they have appointments, talking about the risks of violence and substance abuse during teenage pregnancy, right? Here's some med-surg questions. Gastric bypass complications, home visit. So I would gather that they're going to be asking, the client had a gastric bypass and you go visit the home, and you observe what? Whatever kind of complications. So please be prepared to answer a home visit with potential complications from a client who had gastric bypass. Another med-surg question with regards to disaster, specifically disaster red tag triage. What's a red tag?
Is that the one that they need blood?
Nope. What's a red tag?
Isn't that mean that they're really hurt, but they have potential to live?
Mm-hmm.
Yeah.
It's right in your disaster section of your study guide. Gives you all the tags. Apparently, they're asking something specifically about red tags. I would know all the tags, but the last HESIs indicated they were specifically asking about red tags. Anthrax incubation. Pretty specific right there. It's covered in your study guide. Read up on anthrax. Anybody know off the top of their head what the anthrax incubation period is? It'll be right in your study guide in the disaster section.
Isn't it until the scabs, or the lesions are scabbed over?
Somebody go into the study guide and read that section about incubation period and read it to all of us, so everybody knows. While we're waiting for somebody to pull it up, I just want to go back and show you. Look at the front of these lines. Med-surg, maternity, pediatrics, fundamentals, pathophysiology, peds, professional issues. Okay, so you can see how med-surg this is focused, and peds. Did anybody find that incubation period for anthrax in the study guide? Otherwise, I can go back in and look. Okay, let me go back in. Hey, anthrax. Just want to make sure it's in here for you guys. Sure it is, but I just want to make sure. Bioterrorism agents.
It's 1 to 7 days.
Okay, thank you. Did you get that from your study guide? There's your tags. Red tag. Okay, those who can't survive without immediate treatment, but who have a chance of survival. Okay, so whoever said 1 to 7 days, did that come from your study guide?
Yes, it did.
Great. Okay. So we got the answer to that question. Anthrax incubation. Let's go to the next section. These are pathophys questions. Med surge, cardiovascular, hypertension, BP measure. Maybe what's the normal range for blood pressure? What's high blood pressure? What's low blood pressure? BP measure. Immune system activation. HBV. What's that? Hep B virus. Med surge leadership osteoporosis / prevent. So maybe a question about some ideas about preventing osteoporosis. Okay. So again, each line represents a question. This is what you're going to be asked about.
How would you exactly prevent osteoporosis as far as like you're talking about like diet wise or like moving, just
Well,
not
think about it. Osteoporosis, well, probably your peers can answer that. What kinds of things would you teach early on
to prevent muscle wasting?
To prevent osteoporosis? What kinds of things can you do to maybe prevent osteoporosis?
Stay mobile, diet.
Exactly. What else?
Fall safety.
I mean, it couldn't be any more clear. Osteoporosis prevent. It's got to be a question about how do you prevent? What kinds of education would you do to help educate on how to prevent osteoporosis? Next one was Pete's question, endocrine. Ancanthosis nigricans. What is that? Screening. Okay, it has screen. Why do we screen for it? What is it? What is it associated with? Why do we screen for it? Come on, somebody's got to know this.
It says it can be a warning sign of cancerous tumors.
Diabetes.
Diabetes, yeah.
Yep. That's why it's in the pediatric section. Another pediatric, growth and development, school age screening. I'm thinking they're going to ask what might be common school age screenings that are done in the pediatric, in the kids. Maybe vision and hearing, height and weight, BMI. When needed, life screening. Question about the school nurse and how she handles ADHD. So you guys are well versed on ADHD. Not sure what they're going to ask, but there's a question about ADHD. Vision screening in preschools. Here's one in pediatrics, trauma emergency, healthy people 2030, adolescents. Go back to your section at the very beginning, patients, clients across the lifespan, and review adolescents. School age children, parent focus groups, pediatric screening programs, professional issues, teaching seatbelt safety, immunizations, seatbelt safety for adolescents, bicycle injury prevention. And these are all pretty specific. Here's some professional issues, assignments in home care. This is probably, I'm thinking, maybe a delegation question, right? What do your assignments look like in the home care setting? Bioterrorism, sudden community outbreak, community resources in rural. What do we know about community resources in the rural communities? Are they increased or decreased?
Decreased.
Decreased. Yep. Community assessment. How do we gather morbidity data? It says gather. How do we gather it? Where do we get that from in the community? Health department, vital statistics, other professional issues, communicable diseases. This is under legal and ethical. So I'm thinking it's going to be something maybe about reportable. Communicable diseases are reportable. Community clinic financing. Maybe, I don't know, as you're putting together proposals for an annual refunding of your clinic, what's important to include? Have you met your goals for the past year? If so, how? If not, why? Okay, this is in red, so it's something that students missed. Research and theory, specifically assessing trends and patterns. What do we think there?
Maybe like your food poisoning or your outbreaks.
I was thinking outbreaks, Leslie. That's what I was thinking. Assess trends and patterns. Remember, you have your observation and your surveillance. That goes back to epidemiology. Assessing trends and patterns. Abby's shaking her head. She agrees. Okay, here's another group of med-surg questions. Priority HF lab results. What's that?
Heart failure.
Yep. So if you are looking at heart failure lab results, what are you looking at? What are you most concerned about? Med-surg, teaching, conjunctivitis, home care. Conjunctivitis is covered in your study guide. Go through that. Also teaching about the HPV. What's that? What's HPV? Leslie, you said it, but you're on mute, but I could read your lips. What do we want to teach about that? That is right in your study guide. There's a section on that. Let's see, primary prevention, cancer. So what are we thinking about? Wait, I want to go to Carrie on this one. Carrie, I put you on the spot. Primary prevention with cancer, what could we be doing?
Teaching about modifiable risk factors, like adjusting your nutrition and exercise habits and things
Dangers
like that.
of smoking.
Quit smoking and yeah.
Right? Excellent. Carrie and I know why I put her on the spot, right?
Yeah.
Good job. Great. So primary prevention with the topic of cancer. So that would be a whole bunch of education. What's common? Lung cancer, talking about the effects of smoking.
Skin cancer, sunscreen.
Skin cancer, sunscreen. Exactly. Great. Awesome, guys. Great job. All right, here's a psychiatric mental health question. And it goes through, or the subject matter is psychiatric mental health, fundamentals, geriatrics, depression, grief, basic nursing skills, nutrition. So geriatrics, home nutrition. I'm gathering they're going to want to know what would be an adequate diet. How do we teach good home nutrition? How do we assess that there's home nutrition is adequate? Okay. And then there were 3 other mental health questions that students struggled with in the last 2 terms. Okay. These are all under psychiatric mental health. First one is med-surg question about depression and grief. Okay. Home health, dying client. What do we think? It's a med surg question. So what might it entail? Maybe what are the ultimate goals of home health with a dying client as far as pain control, medication control? What else do you think?
Maybe
That's
also
what,
education on like hospice and like what hospice care is and explaining it to the family.
Yep. Yep.
Maybe like behavioral watch with it being depressing grief, like maybe
Yep.
if they want to, not live anymore.
Last two were about psychiatric, mental health, professional issues. The first one was abuse, teaching, leadership, occupational health, smoking. So that tells me that the occupational health nurse has the opportunity to teach about maybe the dangers of smoking or smoking cessation. Lots of workplaces offer smoking cessation programs. It has to do with occupational health. That's to me what it's going to be about. Teaching, abuse of tobacco, teaching, occupational health is trying to keep, occupational health is all about keeping employees healthy and at work, right? And then, again, mental health, psychiatric, okay. Anxiety, communication, abuse, legal and ethical. Battering is the topic / communication. I don't know, maybe how do you recognize battering communication, right? Or how do you assess it? What do you do? How do you identify it? Anxiety, communication, abuse, legal and ethical. What is our legal obligation to recognize a battering relationship or when it's going on? What do you think?
I mean, reporting the abuse.
Yeah, maybe it's about reporting, that we're mandatory reporters.
I thought we couldn't report, or we didn't have to report domestic abuse. I thought that we only had to, like, we can only give them resources, but if it was like child abuse, that we had to report it.
No, if you're required to, we're required to report anything going on that is of concern. Anything.
I don't know.
So that's a summary of all the different topics that are going to be asked about. Is that helpful to go through? Again, I don't know the specific questions. I just don't, but I know the topics. Okay. Did you guys take good notes? Well, this will all be on the recording as well. So that's as close as I can get for an accurate review with regards to what's been covered on the last 3 or 4 HESIs. It's been pretty consistent. There's been a couple of tweaks here and there, and we've adjusted that spreadsheet. But that's the content that you're going to be asked about. Okie dokie. Does that help? You guys will be fine. You guys have been a great class. Fantastic class. Really engaged and really fun to teach. I appreciate everybody's involvement and everybody's accountability with homework and assignments and communication. You guys will be fine. You guys have done really, really well as a whole, as a class. You guys have done fantastic. It's hard to jump into this community class. It just kind of comes out of nowhere, right? It's different. Doesn't have clinicals attached or sims or labs. It's trying to pull everything together. Not only are you trying to pull everything together, but now you're changing the setting, jumping out into the community, which is a whole new world. So yeah, it's tough to grasp at the beginning. It is, but hopefully you have a better understanding of community nursing, community health, and all the different aspects of community and public health that you may not have thought about. It's a big umbrella. Lots of things. I mean, patients go home from the hospital, go home from rehab facilities, have injuries, go home. Community nursing cares for those patients in the home setting in lots of different ways, as we talked about all the different roles. So I appreciate you guys hanging in there with this class. You guys have done really well. I'm very, very proud of you. It's been a pleasure to teach all of you. It really has. So keep me posted on your HESI, okay? Let me know how you do. I know you guys are going to do great, but I'll be following along as well. If anybody needs to meet again before your HESI, there's just something you're not grasping, something you have no clue about, you just can't get it, please reach out to me and we'll do a quick Zoom and go through what you're having trouble with. Okay? Okay. How about a couple of minutes of the gift of time?
Thank you.
Okay. Feel better, Jonathan?
Thanks.
Okay. Anybody have any questions? Best of luck on the HESI, you guys. Okay? Reach out if you need anything and let me know how things are going. And don't procrastinate on your remediation. Just get it done. Okay? Bye, everybody.
Bye.
Good luck. Good luck. Good luck.
Thank you.
You're welcome.
Bye.
Bye.